in early stage HER2 positive breast cancer, the standard of care has been 12 months of trastuzumab. We had 3 major trials that kind of definitively proved that, one that also compared 2 years versus 1 year, and we settled on 1 year being optimal. So we've had 3 prior trials to the PERSEPHONE trial that looked at shorter duration of adjuvant trastuzumab. And the PERSEPHONE trial, which was presented here at ASCO, showed that 6 months of adjuvant trastuzumab was non-inferior to 12 months. We saw the FAIR trial, the French trial of 6 months versus 12 months, actually quite a few years ago, and it didn't meet a non-inferiority boundary, although the results were actually quite close. We then saw 2 trials of 9 weeks versus 12 months of adjuvant trastuzumab, the ShortHER trial and then the SOLD trial done by the Italians and the Finnish, and both of those also came really close to meeting a non-inferiority preset boundary, although neither of them met that boundary. But when we looked at those curves, a lot of us said, wow, you know, I'm a professor of global health. I go to a lot of countries where women get no adjuvant trastuzumab. Even 9 weeks, and in the case of PERSEPHONE, 6 months, if I can go in and talk to a policymaker, a minister of health, and say, look, if you just get 3 doses or 6 months worth of doses, and think of all the patients you can treat for the same amount of money as we were originally telling you needed with the 12 months. So in the United States, I think we really do need to look at who can back off now. I think rest of world, especially low and middle resource countries that are just starting to look at how do we get trastuzumab in the adjuvant setting, especially now that the World Health Organization lists trastuzumab on their essential med list. So that means we're supposed to be trying to figure out how to get this very effective drug to our patients. So it's a very interesting study, and I don't think that because we've had a few smaller trials that did not meet non-inferiority that we shouldn't pay attention to the PERSEPHONE trial.